My name is Lindsay Segi, and this proposal that we're going over today is my proposal for an outpatient clinic on a necessary health need in Bowie County. According to county health rankings and roadmaps, Bowie County is listed as one of the unhealthiest counties in Texas. We are in the 0 to 25 percentile. Our average median income in the county is about $40,000, and the demographics average from about 60% white, 20% black, and then Hispanic. The main causes of the unhealthy in the county is the obesity ranking. We are at 37%, where Texas median ranking is at 34%. And the national average for obesity is at 30%. So that puts us in the higher bracket. That is one of the leading causes of health concerns in our county. The main causes of death in our county are disease of the heart and cancer. The county so far has limited access to healthy foods. We are ranked at 9% for that, with the national ranking of 9% and Texas average being 8%. Obesity and weight loss centers. Our county does not have access to a physician-led weight loss center or obesity center. What I'm proposing is an obesity and weight loss center that is staffed with physicians. It will include a nurse. It will include other programs like a licensed therapist for the mental health awareness. They will help deal with social anxiety, depression, self-esteem, all of the mental health issues that come with obesity. It will include a gym inside for physical activity, which will also include open to the community to have access to. We will staff personal trainers on a per diem basis. They can do individual group classes. And then it will also include a dietitian for nutrition or a nutritionist for meal planning and helping patients understand eating healthy in order to their care plan. The goals of the facility are to create access for the community to treat obesity and include weight loss programs. We want this to be a long-term program. Patients come in and will be assessed for any healthcare needs they have planned or they have. They will include a care treatment plan from the physician. Any services or tests that need done, we can do over at the hospital. The physician can then refer them to the nutritionist for their meal plans, how to eat healthy, educational knowledge. They can go to the physical or the certified therapist in order for the mental health assessments. If they need help with social anxiety, if they need self-esteem issues, this gives them someone to talk to. We'll also want to include the gym, give them a physical place to work out and to get physical exercise. We want it to be a safe setting. Treatment plans are all-encompassing, long-term plans. The importance is to improve and maintain the health care in the community. This seems to be a growing need. We want to address all aspects of weight loss, underlying health concerns, which is where the physicians come into play. We want to create their treatment plans, give them access to things that they don't have access to in the community. Financial-wise, 18% of all Texans are uninsured. We will be able to accept insurance, all private insurance, all the same insurance that the hospital already has contracts with for the providers or for the carriers. We will participate in the Medicare and Medicaid plan just like the hospital does. And we will accept private pay patients. We can do annual promotions or semi-annual promotions, even quarterly, for gym memberships for outside community members that are not established patients. If people in the community just want to use the gym, we can get the revenue from them and put them on memberships as well. We can apply through grants. We can get grant money from USDA loans or USDA grant programs that we can have an application process for our patients, the ones that don't have insurance or that are having financial difficulties. Maybe they can apply for funding through the grant that we can receive through USDA, as long as they qualify. Staffing wise, we're looking at 2 physicians on staff, 1 nurse, licensed vocational nurse, I feel like this is necessary. We don't necessarily need a registered nurse, but an LVN in the clinic setting would do. We need admissions clerks. These will be brought in. We need to add one FTE to our admissions department. We will bring them in from the hospital, so that way they are cross-trained. So we are using the admissions clerks from the hospital. So this will allow for adding an FTE to the hospital's admissions, but it gives access to the entire admissions department. Whether someone calls in sick or someone's unavailable and we don't have coverage, everybody will be cross-trained in the clinics. We'll need to add an FTE for our environmental services department because we are adding another building or another floor, an outpatient clinic. That will be also rotated through the hospital. Everybody will be cross-trained, and that will be anybody can come over instead of one specific person. We will employ a licensed therapist that will be on staff, so that's one FTE for the clinic. A licensed dietitian or nutritionist will be a full-time staff at the clinic, and then maybe 2 personal trainers on a per diem basis. And the staff ratio to physician is probably going to be about 3-to-1 inside the facility. We want to utilize internal staffing as much as we can. It saves on adding FTEs. The competitions that I see that we will have is through the other hospital in town. We all know there's 2 major hospitals. We are one of them. We're on the south side of town, and the other one is on the north side of town. Our demographics are a lot different from their demographics, so we have the lower income side of town and the lower income patients. The threats to these would be nutritional based companies, or the threat to the program is nutritional based companies that sell supplements, education on nutrition, gyms with memberships, but nobody in the community actually has a physician-based weight loss program or physicians that treat specifically obesity. For policies and procedures, we will be, to save time and to be consistent throughout the health system, we will be adopting the hospital's policies. We will add the quality control measures from the hospital with addendums to include the outpatient clinic. We will currently utilize the health information management system, so that way when the patients come into the outpatient clinic for the obesity treatment, if they need to be sent to the hospital for any screenings, any blood work, any lab work, then those patients will have, we will have, the physicians will have instant access because it's the entire health information system. It'll be all connected. So it goes for quick results, getting back to the patients. Overhead estimate is roughly $1.1 million. With the equipment, the total clinic costs for startup would be 1.1 or 1.16 million. Reimbursement per patient based on our RVUs in the rest of Texas is $148.49 per patient. The break even is 7,794 patients a year, which would calculate to roughly 75 patients a day. This is all a rough estimates. If we get the salaries in place, utilize the equipment that we have, of course, these are all estimates they go off of. They will be cheaper in the long run. The community has limited resources in education when it comes to healthy living and nutritional lifestyles. Our county has resources that consumers can buy, such as supplements, diet exercise tips, meal plannings. What the county lacks is the medical aspect of weight loss. Obesity is a growing concern in America, and providing quality and safe healthcare for those in need is all-inclusive and just the beginning of establishing a healthier community. We strive to live healthy and long lives, and as a community, we wanted to create a happy, healthier environment for ourselves and our future community. The outpatient clinic that we have proposed will give the chance to everyone in the community. It will give them a safe, confident place to seek for their medical conditions related to obesity, while putting them in a care plan that will change their lifestyles and eating habits for the better. Our patients will be put on a long-term plan and not just short-term solutions. They will be allowed to continue treatment using our physical gym, have access to personal trainers, and be able to utilize our therapists for their mental health. The community will become healthier, and the patients in clinic will spread awareness for health conditions and concerns that come from obesity. Thank you, and I hope we are able to come to a resolution and we begin this clinic and this journey.